Hi everyone, how are you doing? Welcome to the physioBRAIN channel. This is Professor Adriano, and today we're going to be wrapping up our series on respiratory disorders. We've already talked about pneumonia, we've discussed acute viral bronchiolitis and bronchitis, and today we're going to talk about asthma. So stay with us, because we're going to share this information with you. And don't forget, go ahead and subscribe to the channel, like the video, and share it with anyone you think needs this information. So, asthma, right? What comes to mind the first thing we think of or talk about when it comes to asthma? We think of someone who has to use an inhaler, right? That's a bronchodilator, which, generally speaking, helps the bronchial tubes in the lungs to open up. But after all, why does a person need a bronchodilator? It's very common for people to develop asthma, usually due to genetic factors. There's a genetic component, right? So the person is born with asthma. But asthma can show up differently from person to person, you know? Each person might have, for example, a specific trigger that causes inflammation or makes things more difficult, right? It could be, for example, a specific smell, pollen, or some other factor that causes this constriction, you know, this spasm in the bronchi. So, asthma is characterized by these spasms in the pulmonary bronchi, which make them narrower, right? So, the blockage can be quite significant, and that's why the person has such a hard time breathing, right? And there's a very classic sign that can be used to identify asthma, which is characteristic. It's the wheezing in the chest, right? So, that person who, when they breathe, whether it's a child, an adult, or even an elderly person, has trouble breathing, and you can hear that wheezing in their chest, like there's a cat meowing inside their chest, you know? So, that wheezing can be a sign of asthma, okay? Which is characterized, then, by this spasm in the bronchial region of the lungs, which causes difficulty breathing, respiratory distress, and then various changes can happen as a result of this process of excessive CO2 retention. The person may experience some issues because of that. But, in general, what we want to highlight here is that this is a lung condition that has an impact on a person's life. The person needs to use a bronchodilator and have regular health checkups, right? So, if you have asthma or know someone who has asthma, right? Share this video with them so that they can get a general idea of how it works, and so that we can make sure to refer them, whenever possible, to the nearest healthcare service, especially if we notice any kind of attack, right? We should always be alert to the signs and symptoms that the person shows, okay? That's basically it. If you have any questions, write them here in the comments. Let's keep sharing this information. Let's spread quality health information in a simple and accessible way for everyone. Take care, and I'll see you in the next videos.